That was great. Well, we're gonna roll right into the keynote speaker, the last speaker, and I'm gonna introduce Sandra. You can make your way up here. Many of you know who she is. In 2008, Sandra, actually I'm gonna start back. Sandra is a proud U.S. Army veteran and has a BS and MBA degree in business management. She's also certified as a project management professional and as a Lean Six Sigma Green Belt. Sandra works full-time as a project manager for Xerox in her free time. She is an active community member and volunteers in the Pleasanton Chamber of Commerce Foundation Board. She's an advisory board member for Hope Hospice, as well as a role of president and founder of the Sandra J. Wing Healing Therapies Foundation. The language of cancer is grim. You've heard a lot about it today. We talk about cytotoxic, we talk about things that address cancer cells throughout the body, chemotherapy, biologic therapy, radiation therapy, lumpectomy, mastectomy, bone marrow transplant, neuropathy, nausea, hair loss. But cancer survivor Sandra Wing has introduced a different vocabulary vernacular for us as cancer patients and as providers. Acupuncture, acupressure, meditation, guided imagery, therapeutic massage. In 2008, she created the Sandra J. Wing Healing Therapies Foundation to help remove some of the financial burden so that a cancer patient can experience healing therapy comfort throughout his or her treatment. I had the privilege of serving on the board for just about 2.5 years, and it's remarkable as a healthcare provider talking about radiation therapy, chemotherapy, dosing, and being a part of the therapy. It actually comes relatively easy to us. But the privilege of being a part of people's lives, sharing stories like Lorna's, being associated with folks like Sandra is a gift, and one that keeps us coming to work and keeps our job in oncology very rewarding for Dr. Sani, Dr. Chang, and myself. Sandra is influential, she's charismatic, she's dedicated. The effort she leaves, in my opinion, makes having cancer just a little bit easier, and being a provider for cancer patients that much easier. She addresses quality of life, and she's going to talk about that, but she also importantly she makes us look good. She enables patients to go through and complete the care that we know about and want to provide to optimize her outcomes. She's a personal friend of mine and truly a local community hero. Sandra, come and tell us about your story.
Good evening, and thank you, Rakesh and Dr. Sani, and I'm just so proud to have an opportunity to speak at the 5th annual event tonight, so thank you. I'm going to talk about my personal cancer journey, where I started, and what transformed out of that to create the foundation that I'll tell you a little bit about. So, one of the things that I was afraid of was needles. Never liked to be poked, and I was afraid of anesthesia, because I was just worried about it. And so when I was told when I was 47 years old that I was going to have a hysterectomy, I was pretty scared, because having a major surgery was very frightening. And fears with all of us, start from something in your background probably. And mine was that 25 years earlier, my friend, her mother was the same age, 47, and had a standard hysterectomy, and she never came home. So I was very frightened of having a hysterectomy surgery, and she didn't come home because of the side effects of the anesthesia, and she went into a coma. And so my fears were pretty heavy, and I didn't know what to do. So my spouse and I, we contacted a friend of ours who was a radiation oncology nurse, lives in Virginia, and we said, you're also a holistic nurse, and do you know anybody out here? I'm going to have a hysterectomy surgery at UCSF. Do you know anybody out here that I could talk to, because I'm really frightened? And it had nothing to do with having cancer. I was just frightened of the needles, frightened of the anesthesia. And she said, yes, I do. So she recommended me to somebody at UCSF who was a oncology nurse there, but she was also an acupressurist, a guided visual imagery specialist, and somebody that taught me to focus on my breath and to deep breathe and meditation. And so I went to her for 2 weeks before my surgery. And that was just incredible because it calmed me down because I was very nervous and very anxious about the surgery. It calmed me down so much that the day of surgery, I went to saw her for 1 hour before the surgery, and then I got poked and prodded with those IV tubes for pre-op, and I was calm, wasn't worried about it. I was miraculously calm because they had an emergency surgery, so while I was in pre-op, I was there for 5 hours until my surgery came up. So that's quite a long time to be in the position that you didn't want to be in. So I went to the surgery, came out, and all I really wanted was that same lady to come in the room the next morning, which she did, and gave me a massage and got me out of the bed and had me focusing on healing thoughts the entire time, those 2 weeks before, and was all focused on helping me think, healing thoughts, coming out on the other end, taking away the nervousness and the fear that I had of the potential outcome. And the doctors and nurses at UCSF were kind of surprised that I didn't need as much drugs as are normally standardized for the outcome of that surgery. And I credit all of that to what I just said. Guided visual imagery, thinking positive thoughts, thinking healing thoughts, thinking of the outcome, and believing much more positively and focusing on that. Some of the visualizations that I had were things like this. This is golden healing rings around my body, like a slinky almost, right? Kind of circling your body. And I had different guided imageries, different thoughts. Some of them were me floating on water because I like Hawaii a lot, and having my dog on my stomach, and we were just floating, very calm. But the point is, that's what guided visual imagery does. It takes you into a different space, a different place, so that you're not so stressed out or anxious or thinking about the bad outcomes of a diagnosis. Anyway, that's when I got out of the surgery is when we learned that I had ovarian and uterine cancer. So, needless to say, I really stayed with guided visual imagery and these healing therapy massages. I was fortunate; they were caught at the early stage, but the cancer cells were aggressive for the ovarian, so they said we should have a full range of chemotherapy treatments. So that's what I did, and stayed with these healing therapies, these therapies that I never tried before until this experience. And these therapies not only helped me as the person going through an unpredictable disease or problem or health issue, but they help the caregiver. They help beyond just that person trying these therapies. And what do I mean by that? My spouse, Gracie, was shown how to apply acupressure on me when I was really restless or anxious or couldn't sleep, because maybe it's the side effects of the drugs, or maybe it was just because my thoughts were thinking negatively. Nonetheless, she would apply these techniques on me. So it helped me. I went to sleep. But guess what? It also helped her because she was able to go to sleep. So what I'm saying is it's beyond even the person receiving these treatments. It helps the caregiver, it helps the family, it helps the village when that person has a little bit of calmness and can not need so much caregiving. And the other thing that happened to me was, remember I told you I was afraid of needles. So it wasn't just the IV tubes and the stabbing that you go when you're going in for chemo, but about halfway through, I developed neuropathy. and neuropathy for folks that may have diabetes or have had experienced this side effect from chemotherapy. It's the numbness of your fingers and your toes. And it's the nerve endings. And they get really sensitive, and it gets difficult to button your buttons and feel that what you're stepping on. And it can be debilitating, and it can actually be a permanent damage type situation. So my oncologist said, well, I think you should maybe consider, we should probably look at considering stopping or just, slowing down the treatment. Well, there was no way I was going to do that, because I really wanted these cancers out of my body, and I wanted them gone. And no, I wasn't going to do that. So what was the other option? And we discussed acupuncture. All right. So the person afraid of needles went to acupuncture. It's really not that bad. It's it's like a pinch. But, but I went. It was amazing. It really helped me a lot. It helped me so much that the neuropathy went away. And so I really believe in acupuncture. And finished the chemotherapy treatment, still applying the same therapies that I'll tell you about the foundation in a minute, still applying the same therapies. When you're done with your treatment or done with your cancer journey, you enter survivorship. It's an awkward little space for those that are survivors. It's awkward because your friends and family want you to move on and tell you, they're saying you're normal, you're okay, get back to normal. But what is normal after that? And it's really hard, and you want to get back to normal, and you want to be that for your family because they've been there for you during this bad experience. So these therapies, guided visual imagery, deep breathing meditation, therapeutic massage, acupuncture, they're all good for you all the time, even after cancer treatment and through survivorship, and helping you stay focused and help you stay positive and help you stay the course. And one of the things that most people don't talk about is the financial element of having an unexpected disease enter your life. Most people don't talk about that. But usually it's either the person going through that disease that's not going to work, so they're going to have a reduction in salary, or it's going to be their caregiver because they need to be around, so they're going to reduce their hours. So you see your finances going down and your expenses going up because you didn't plan or prepare for the unprepared thing. So now you have your co-pays on your health insurance, whatever that plan is, for all of your expenses. You also have your pharmaceutical co-pays. You also have the fact that you're going to UCSF, so you got your $5 or $6 every time going over the toll with the bridge. You also have your parking, which 5 to 10 minutes in the parking lot at UCSF is $20. So it gets costly, and it adds up. And those are the things people don't talk about. So we are fortunate. We think we spent about $5,000 or $6,000 on these healing therapies. But we were fortunate we could do that. Not a lot of people are that fortunate. So after cancer treatment, and in 2008, I took 2 years off of work. So we lived on Gracie's salary and stayed fully dedicated to start the Sandra J. Wing Healing Therapies Foundation. And we did that. We're really proud of it, and what we do is we provide financial assistance to cancer patients here in the Tri-Valley area, and it's real tangible stuff. And I'm just gonna, by the way, this is me going through cancer treatment, and some of the things that the therapies helped me on was all that I'm listing up here, and I talked about the nervousness and anxiousness, and I was really fatigued during that time. I was so exhausted that just going from my bedroom to the living room, I was tired. That was exercise for the entire day. So these are things that other people that we've helped have said how these therapies have helped reduce these conditions in their lives. these side effects: nausea, constipation, stress. Most importantly, staying the course. And these are some things that the therapies help the people with: improving mobility, inducing relaxation, increasing the appetite. And these are just some testimonials of folks that we've helped. What's really cool about our foundation is that it's here. We're making a difference with people going through a really crappy time in their life right now. We're helping them to stay the course, follow the treatment, follow the chemotherapy, follow the radiation, stay the course. Because you go to the treatment, you get beat up, right? You feel like, I don't know how a lot of you felt, but I felt like a baseball bat had just hit me after every chemo treatment. Battered and bruised is kind of how I felt. And these things help that person to go, okay, in 3 more weeks or next week or whatever it is, I'm going to have to do this all over again. I'm going to get enough energy to do this all over again. And so just Sunday, I was at Safeway here in Pleasanton, and there was a woman who clearly had no hair, and Gracie went up to her and said, "Are you going through cancer treatment?" And she said, "Oh, yes, I am." And Gracie said, "Well, have you heard of the Sandra J. Wing Healing Therapies Foundation?" And she said, "Well, yes, I just got a grant from them." And she walks over and introduced her to me. And that's how tangible this foundation is. We are helping people, running into people in our town that we're helping. And I know we've helped a number of you here, and that's what we're all about. And the table over there, if you just wave your hand, over there, okay, in the corner, if you didn't stop at our booth tonight to ask, about us or find out about us, I hope you will tap one of these wonderful folks. We've been really proud. We have 100 volunteers, and we just surpassed, after 5 years of issuing grants, our 500th grant. So we're really proud of that, and so thank you.
Okay. Well, thank you very much, Sandra. That was fantastic. Well, this concludes our program. Thank you so much for being here and sharing your story with us. With that, I'll conclude our symposium, and we'll look forward to next year. Thank you very much.